heard the reports about global warming.
And whether you believe in climate change or not, the United States is out with a new report called The Effects of Climate Change on Individual Health. We have Dr. Jennifer McKinnon here with the Medical College of Wisconsin. She joins us now live this afternoon. And a lot of people probably don't even think about this, but how does this really impact our human health?
It's a complex issue because there's a lot of debate, but when you look at the international perspective with the United Nations report and scientists from all over the world that say global warming or climate change is happening, it's something that we need to take into account for public health, because public health is global. Individually, people with heart disease, lung disease could definitely see rises in their exposure to pollutants. Ozone days, for example, could really be a problem in big cities.
What about the extreme in temperatures? How does that affect our health?
The extremes can really affect on having very warm and hot days where elderly and children just can't seem to get into cooling places, or certain third world economies, for example, won't have cooling structures for people, and then it could affect them on especially hot days.
You were mentioning some of the groups. What are the groups that we have to be concerned about of people?
Right. The elderly, for sure, is a very vulnerable population. Women and children just aren't as mobile, especially in more third world countries. So looking at climate change, we have to look at it in a global perspective, not just here in the United States.
The climate change debate has been going on for a very long time, but how does this now tie into the healthcare perspective as far as urgency goes?
As far as urgency, we'll see different trends of numbers. Anywhere from by 2050, we could see a rise of 2 to 10 degrees Fahrenheit, which could be quite more than we thought, I think. So that's why a lot of organizations are coming forward and saying we need to reduce our carbon emissions if we can by 2100, and it's possible for us to do that, and they're making commitments. Europe is making commitments of 50% reduction, and the United States made a 25% commitment recently in Paris at the big conference there.
So yeah, it has become, it's a big issue. People talk about it, they have opinions on it one way or the other, but you gave us some perspective at least on the public health issue of it, so we appreciate you sharing that insight. If you have a question for our experts, email them at asktheexpert@todaystmj4.com. You can also leave a voicemail. The number's right there on your screen. We'll be right back.